course today. Today we're going to be assessing your chest and your lungs. So we're going to be listening to your breath sounds and everything. So can you please tell me your name?
Diana,
And how old are you?
28.
Okay. So are you having any problems with breathing, feeling short of breath, feeling sick at all, coughing?
No.
Feeling normal?
Yes.
Yeah. Okay. So what we'll start off with is by checking your chest shape. So basically we want to make sure that your chest isn't protruding. That could be a sign of like COPD or not enough oxygen being circulated through your blood. And I'm going to feel the back of your spine just to make sure all the spinal processes are normal and aligned. So no scoliosis or kyphosis, which is a bending of your spine. And it looks like everything is aligned and straight. So that's good. And I want to check your fingers just to see that there's no clubbing or like a blue kind of tinge to it, because that could be another sign of poor circulation or oxygen blood levels. All right, so that looks good. And so also I wanted to mention that I wanted to check your landmarks here, which is basically your sternal notch, which is right up here, and the angle of Louis is right here in your chest, which is kind of where your sternal notch is, right here in the middle, and that looks fine. So I also want to check for pectus carinatum, which is basically when your chest kind of protrudes outwards, which looks like it's totally fine. And then there's also something called pectus excavatum, which is when it's kind of inverted. So it's basically pushed in, which is from the side looking at it, it looks totally normal. No barrel chest or anything. So when I press on your chest just to feel for any like lumps or anything, can you tell me if it hurts at all anywhere?
No.
No? Okay. On the side?
No.
On this side?
No.
And how about on your back here? Does everything feel normal?
No.
Not painful?
That's normal.
Okay, good. So no tenderness when I was pressing on your chest, right? Okay, good. So I didn't notice any cuts or any lumps or masses on your chest or back side of your thoracic area, so that's good. And what I'm going to do next is check for something called tactile fremitus, which is just like listening for crackles or sounds that should not be there. So what I'm going to do is I'm going to use my hands on the front and back side of your chest, and I need you to repeat 99 each time I press down. Okay?
Okay.
Can you repeat 99?
99. 99. 99. 99. 99.
Great. It's all symmetrical on both sides, which is a good sign. And we're going to do it on the front.
99.
We're going to do it above the clavicle.
99. 99.
Great. It sounds equal on both sides. And so after checking for that, we're going to do percussion of the chest, which is basically me feeling for symmetrical sounds on both sides of your lungs. And I need you to repeat 99 again, okay?
99. 99. 99. 99. 99.
Good. And you want to do that on this side too.
99. 99. 99. 99.
Okay. Great. So it all sounded even. What we're going to do next is listen to your lung sounds. So there's 3 different parts of your lungs, which is basically the thoracic area is up here in your throat, and then your bronchial sounds are going to be right here in the center and kind of in the middle of your chest. And then the vesicular is mostly everywhere else, kind of like below your chest wall, and then like most of the posterior side is going to be vesicular breath sound. So I'll start with the back. And I just want you to take a deep breath each time I press my stethoscope down on your chest, okay?
Okay.
And under your arms. And this side. Great. I'm going to listen to the front side of your chest here. Okay. Great. Everything sounds clear. There's no adventitious breath sounds, which is like wheezing, or crackles, which kind of sounds like your hair when you listen to it. That could be a sign of like lung problems, okay? And so after we've listened to your lungs, we're going to measure something called diaphragmatic excursion, which is basically just kind of measuring the movement of your diaphragm when you're breathing. So I'm going to measure it from back here, and most of the time you'll have a pen and then you mark the spot and measure it from there. So the step in doing that is basically you're gonna take a big exhale and then hold your breath, okay? So go ahead, and when you're ready, you can go ahead and take a big exhale and then hold your breath. And what I'm doing right now is just percussing. And when you start to feel dullness, that's when you mark it. And then you can go ahead and breathe normally. And then once you've marked that, you're going to have the patient inhale and then hold the breath. Go ahead and inhale. Okay, and then from there you measure percussing. And then once you feel a dullness, then you'll mark it again. So that's how you measure diaphragmatic excursion. And basically it should be around 3 to 5 centimeters, and that's normal on average. So after that, we are going to do a few special tests, which are called bronchophony, whispered pectriloquy, and egophony. So basically, this is just a test for like people who have problems like with coughing, or they're having chest pain, or trouble breathing, basically. And it measures or tests for consolidation, which is kind of like a sign that somebody's having complications. So basically, the first test, which is called the bronchophony, is when you have the patient repeat 99 normally, and then you listen. So every time I press down, just press or say 99.
99. 99.
And normally, if they don't have any lung problems, it should sound a little muffled. If it's very clear coming through the stethoscope, then that means there's a little bit of consolidation, perhaps. The next test is called the whispered pectriloquy test. And what we're going to do this time is you're going to whisper something like 1, 2, 3 each time I press down on your posterior side of your lungs here. And basically, normally, you shouldn't be able to hear through your stethoscope. And if there is some consolidation, you will be able to hear the 1, 2, 3. So let's try. Go ahead and whisper it. Alright, so all through her lung field, I was not able to hear it, so that means she has healthy lungs. And the last one is called egophony. So basically, when I put my stethoscope on your back here, just go ahead and repeat the letter E. And normally, you should be able to hear E. If you hear a sound A instead, then that could be a sign of some consolidation in the lungs. So let's try.
E. 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 E.
Great, it sounded like E, so that's good. So those are the special tests that sometimes they will use to check for lung problems. So the last thing we'll check for is just making sure that your accessory muscles aren't being used when you're breathing normally and you're not having trouble gasping for air and that kind of thing. And so sounds like your lungs are pretty healthy and you're not having any problems, is that correct?
Yes.
Great, so that concludes our chest and lungs assessment. Thank you.
Thank you.